Hey, welcome back to another Confessions of a Male Gynecologist. I'm Dr. Shawn Tassone, America's Holistic Gynecologist and author of the Hormone Balance Bible, where you can get that on Amazon right now. I would actually get that book because, well, I'm a little biased, but it does help understand the dynamics of hormones, the reason that we use hormones and what they do in the female body. And I go through the top 12 hormone imbalances in women. Today, though, I want to talk about something that's obviously an issue for women, especially those in the perimenopause and menopause area, and they want to lose weight. And you hear these terms thrown around a lot: Metformin, Berberine, Dihydroberberine. Now, obviously, the GLP-1s, Ozempic, Monjaro, those are huge news. A lot of women don't necessarily want to go on those medications because of fear, which may be substantiated or unsubstantiated. I do think personally those medications are fairly safe and can be used effectively. And you shouldn't be afraid. You should just be informed. These other meds, anytime you see a company that has GLP-1 or GLP-X or like or whatever, don't take those pills. They're trash. They're obviously marketing on the Ozempic and Monjaro craze, and nothing is going to work as well as those injectables. However, if you want to work on something, if you want to try something, and you are afraid of the medications, the injectables, then considering metformin, berberine, and dihydroberberine, especially if you are in a pre-diabetic, diabetic, insulin-resistant state, polycystic ovarian syndrome, this is a super easy way to kind of gently ease yourself into those medications. And I wanted to just go over those three things because metformin, berberine, dihydroberberine, they get thrown around a lot. And I have people asking me daily, weekly, what the differences are and what we can do. So let's just start with metformin. Metformin is itself, out of the three, metformin, berberine, dihydroberberine, metformin is the only one that's a prescription. Berberine and dihydroberberine are over-the-counter supplements. Now, why is metformin prescribed? Why do doctors even prescribe it? Well, it's used alone or sometimes with other medications, including insulin, to treat type 2 diabetes. Metformin helps to control the amount of glucose that's in your blood. It decreases the amount of glucose you absorb from your bloodstream, from food, obviously, in the GI tract, and then changes the effects of the amount of glucose made by your liver. So metformin can increase your body's response to insulin. Over time, people that have had diabetes and high blood sugars, you know, obviously with diabetes, they can have other life-threatening complications. So treating diabetes or pre-diabetes is super important. I started using metformin years ago, probably over 10 years ago, with polycystic ovarian syndrome patients because we realized that women that were on the metformin actually started having regular cycles. Now, it wasn't everybody, but there was a large number of women that if they had polycystic ovarian syndrome where they weren't having regular periods and they were insulin resistant, they started having regular periods. And the interesting thing about that was while they started having regular periods, they weren't necessarily losing weight, but the periods came back, which was kind of great. Metformin itself as a medication comes as a tablet. There's regular acting, there's extended release tablets. There's also a liquid solution you can take by mouth. I don't usually prescribe that one. Basically, you want to swallow the pills, not chew them, especially if it's the extended release. And usually the dose ranges on the metformin are going to be between 500 to 2,000 milligrams a day. Usually, if you're not taking the extended release, you're going to want to take it twice a day. I will usually start women on 500 milligrams, go up to 1,000, then go up to 1,500 and 2,000, depending on how they do. Basically, the only times you don't want to take metformin would be obviously if you're allergic to it, if you've ever had low levels of vitamin B12, because vitamin B12 is absorbed in the gut, and metformin inhibits some absorption, so you could become vitamin B12 deficient. So usually if you're on this medication, you want to cycle off of it probably every 3 to 4 months for a few weeks, just so you can get the vitamin B absorption back. Basically, the side effects. What are the side effects of the medication? Metformin is pretty well known for causing diarrhea. It can cause some GI pain. It can cause some distress, diarrhea, nausea, stomach discomfort, gas, indigestion, constipation in some people, which is the exact opposite of diarrhea, headaches, flushing of the skin, nail changes, muscle pain, and rash. Now, keep in mind, these are very rare, but they can happen. There have been some recorded cases of what's called chest pain and aplastic anemia, meaning that some people's bone marrow will stop working. I personally, in 20 years, have never seen that. But it can also lower blood sugar. So in people that have low blood sugar or that are on other medications that lower blood sugar, you want to be aware of low blood sugar signs and symptoms, because if you take this medication, you could actually go too low. So low blood sugar, extreme fatigue, weakness, discomfort, vomiting, nausea, stomach pain, a lot of the same symptoms as the actual medication itself. So basically, you want to use this under the auspices of a doctor. There have been some recent studies that have come out on metformin that are starting to show that it can increase lifespan, which can be kind of a nice thing. So you want to keep that in mind when we do this. But obviously, yes, metformin is a prescription. The interesting thing about metformin too is because it's a generic medication, it's not patented. It's just as easy to get as aspirin sometimes. The costs on metformin per month, in many cases in my practice, when I send it to the regular pharmacy, CVS, Walgreens, whatever, it's $0. The most I've ever seen it was $5. So it's rather inexpensive. And as you're acutely aware, the supplements, dihydroberberine, berberine, can be expensive. So it's just one of those things you need to, keep an eye on. Let's talk about berberine next. Berberine is a chemical found in plants. Barberry, golden seal, golden thread, Oregon grape, philodendrons, and tree turmeric. Berberine, any of you that have ever taken a berberine pill and left it in your mouth for a few seconds know that it's bitter tasting. The pills you're going to see when you use it are yellow. It basically can help strengthen anything bitter like that. Bitters, certain plants tend to have positive effects on the body. Now, it's possible for berberine that it can help with certain cardiac conditions. It is antibacterial, can help regulate how the body uses sugar, and can help with swelling. People that most commonly use berberine are using it for diabetes. It also can have a lowering of the cholesterol levels, so it can help with that. And it has been noted to help in high blood pressure. So definitely something to look at when we use berberine. What has it been used for in the past? It's been around for a long, long time, but what has it been used for? It's been used for canker sores. Usually that's in a gel. Diabetics that take berberine usually do an oral amount. Sometimes it's been used for GI tract infections. It can help sometimes with Helicobacter. It can help with levels of high cholesterol. It can lower lipids. Basically, it can help lower the total cholesterol, low density lipoproteins, and triglycerides. In patients that have high blood pressure, if they took a large amount of berberine, usually more than I recommend, the blood pressure lowering drug, it has similar to the drug called amlodipine, and can be even better than amlodipine in and of itself. And like I said, it's also been used with inositol in patients with polycystic ovarian syndrome. That's where I tend to use it the most. The side effects of berberine in and of itself, relatively safe. I mean, you'd have to take a lot for it to be abnormally high usage. If you use the recommendations on the bottle, that would be the best. For berberine, that's probably 500 or 600 milligrams a day. It's been used safely in dosages up to 1.5 grams a day for 6 months. But common side effects are things like diarrhea, constipation, and upset stomach. Most of the time, I usually, if I see anything with berberine, it's going to be the diarrhea and upset stomach. I rarely see constipation. Basically, when you take it by mouth, like I said, it's been used safely for high doses for a long time. It also comes in some skin preparations, can cause issues with a fetus, so you don't obviously want to take it when you're pregnant. You don't want to use it when you're breastfeeding, and obviously I wouldn't give it to children. It interacts with certain medications. Some of these medications are chemotherapeutic drugs like cyclosporin. It can have issues with anticoagulants. For anybody that's taking an anticoagulant, I'd recommend you check with your doctor, or if you're taking an antihypertensive because you have high blood pressure, I would check with your doctor as well. If you're also taking medications to lower cholesterol, I would recommend that you talk to your doctor as well. And obviously, if you're using medications to like metformin, I wouldn't use berberine because they work along the same lines. So there have been some studies on berberine head-to-head against metformin, and actually the results for blood sugar control and things like that have been relatively similar. And I do think that it's funny because berberine probably costs about 10 times as much as metformin, which is the prescription, simply because berberine's a supplement. It's not covered by insurance, and metformin has been around for a long, long time. So it is covered by insurance, and it's like I said, in most cases, about $5. What I will say is that metformin in and of itself tends to have more side effects when I've seen it used in my patients than berberine. I think that's been reported as well. Usually, as I said, the side effects with metformin are going to be more along the lines of GI issues, GI distress, diarrhea, stomach pains, things like that. Now, with both of these approaches, metformin or berberine, you're going to want to make sure that you cycle them, metformin, berberine, dihydroberberine. I would recommend going on them for probably 3 months and taking 3 to 4 weeks off and then going back on. Might be a good idea even to do that with normal supplements too. I just think giving yourself a break for a few weeks can help. So what's the difference then between berberine and dihydroberberine, and which one's best? I will be candid. I used berberine for a long time and just recently switched to dihydroberberine because I have a very good friend who is a formulator of many, many supplements. He's kind of thought of as the guru of ingredients, Shawn Wells. You can follow him on Instagram. He discovered dihydroberberine, and I've had many discussions with him in depth about the differences, and it just seems like a better product to me. Has much higher absorption rates, and overall, I think is just better. So again, berberine, it's a plant alkaloid, getting a lot of attention. There are a lot of supplements on the market that are kind of like GLP-1-ish. If you see a supplement that's being advertised as GLP something or other, I wouldn't use it because they're obviously marketing and they're preying on you. They're making it sound similar to Ozempic. Nothing is going to be similar to Ozempic or Monjaro. It's just not the same. If they have any taglines in there like weight loss was similar, blah, blah, don't believe it. It's complete garbage. You can't really even compare the two. One's an injectable, one's a supplement that's oral. It's just a different power level altogether. I think women that are on Ozempic can lose 15 to 20% body weight in 3 to 6 months. Berberine, I would say, if you're going to have weight loss, it's probably more around 5 to 7%. But so it can cause weight loss, but it's just not going to be the same. One of the things that has troubled me with berberine was that it has poor absorption and poor bioavailability, meaning when you do absorb it, can your body use it? So when you take a high dose of berberine, only a small fraction of that total dose, sometimes could be less than 1% in animal studies, gets into your body, which was a problem because, you're spending $50 on this supplement. You obviously want it to work, but if you're not absorbing it very well, then it's not going to work. So it was interesting when I was listening to Shawn talk about this new product, dihydroberberine. There was a study, relatively small, albeit, that were given 500 milligrams of berberine, 100 milligrams of dihydroberberine, and 200 milligrams of dihydroberberine in different categories, or a placebo. So there were, 4 groups. They found that the individuals taking dihydroberberine saw similar changes in glucose and insulin levels with those that had higher doses of berberine. So it's a lower dose of the product, same results. The implications there being that the dihydroberberine has significantly more powerful than just regular berberine, has the same results, and which is why sometimes in ads you will see 5 times stronger than berberine. It's not that that particular brand or product did anything to make it better. That's just dihydroberberine. So keep in mind again, the sample size on this study was relatively small. The length of the study was a little bit less than desirable, but it's an interesting study. And what I would say is a lot of women will ask me, well, I'm on berberine. How do I switch over to the dihydroberberine? If you want to transition, given the fact that it's about 5 times greater bioavailability than berberine, the dosing should be a little bit different. So if your standard dose of berberine is like 500 milligrams twice a day, then you're going to want to take probably 100 milligrams of dihydroberberine twice a day. And the company that I recommend, that I don't have any affiliation with, this is not a paid endorsement, but as you are aware, because I talk about this all the time, I am a supplement purist. I like to have the supplement in its solitary ingredient. I don't like to have formulas that have proprietary garbage in them, because what happens is when you mix a bunch of things together, 1, you never know how they work together. 2, you can't really use a dose that's great because you have all these other things and you can't make a pill that's the size of somebody's head. So I like endurance products because their dihydroberberine is just dihydroberberine, and it is in, I believe, 100 milligrams twice a day. How does it work? How does dihydroberberine work? It's a downstream metabolite of berberine. So again, berberine has to turn into dihydroberberine. So you may just want to take the dihydroberberine. It's obviously a plant alkaloid because it comes from berberine, and it impacts signaling pathways. There's a pathway called AMP, activated protein kinase, and nuclear factor K3 that it does. And the benefits work on, and studies have shown that there is some decreased inflammation. It decreases oxidation. It can help with weight. It can help with insulin and blood sugar. It definitely lowers cholesterol. I've seen that in myself. There have been some studies that show it reduces the rates of cancer, and it can be beneficial for the cardiovascular system. What are the symptoms of using dihydroberberine? There was one study that showed up to 30% of people can have some digestive issues, diarrhea, constipation, gas, upset stomach, and nausea. But usually those are relatively limited, and usually they're at higher doses. So can taking berberine or dihydroberberine cause hypoglycemia or low blood sugar? The short answer is pretty much no, for a majority of people. However, there's always the possibility. There was one study that looked at the incidence of hypoglycemia. It was over 3,000 patients with type 1 diabetes, and found that the treatment with berberine is relatively safe and did not cause hypoglycemia or increase the risks of hypoglycemia. But if you're around and you're looking and you're Googling, you may find people that have some symptoms, and that's just the nature of the beast. I mean, everybody responds differently, but when we talk about risk, we're generally looking at risk as a whole, risk to the whole population, as we do with most medications. Doesn't mean that it's risk-free. But which is better for weight loss, dihydroberberine or berberine? And I always recommend the dihydroberberine. There is no great evidence, but it makes more sense to me that if berberine had some evidence to show that it was great for what we were prescribing in weight loss, then dihydroberberine would be better because it's absorbed better. So all things equal, I would prefer to use the dihydroberberine. Can dihydroberberine be used in patients with like hypothyroidism or Hashimoto's? The answer is absolutely. It can help work on not just weight, but high cholesterol, insulin resistance, and there's some evidence to show that it may help with inflammation, which is especially important in patients that have autoimmune diseases. I think overall, if we look at these products, metformin, berberine, dihydroberberine, it's really, again, all about personal choice. Now, some women will choose metformin because it's cheaper. I have absolutely no problem with that. I think we all pay astronomical amounts for our insurance premiums. They don't often cover very much, but they usually do cover berberine. And when they do, it's $5. I think even if you had to pay cash for it, it's probably $8. So not super expensive. The berberine and dihydroberberine can run, I think for 3 months of dihydroberberine, you're probably looking at $120, give or take. So it's a little bit more expensive. It's probably $40 a month, $50 a month. Same with berberine. So they can run a little bit more pricey, which is fine. Some people don't mind that, and they like the idea of using a plant alkaloid versus using a prescription medication. And I do think that overall, the prescription does have more side effects than the supplements. However, you might get better results with the supplements. So it's one of those things where I would pick one. I would pick metformin, berberine, or dihydroberberine. If I had to narrow it down, I'd kick out the berberine and I would use either metformin or dihydroberberine. Metformin, you need a prescription from a physician. The dihydroberberine from endurance products, you don't. So it's really personal preference. People that I have on GLP-1s, if they start to stall, if I notice that I'm having to go up more and more on the injectable medications, I will add dihydroberberine because it can help me use lower amounts of the injectable medications. And you just have to look at labs. I will usually look at labs every 2 months, vitamin B12, cholesterol, insulin, glucose, basic chemistry, to look at the lungs, to look at the kidney and liver function to make sure those are okay, and blood count to make sure everything is good there. So a quick down and dirty on metformin, berberine, dihydroberberine, because I get a lot of questions about it and because it's confusing. So I just wanted to bring that to your attention. I think they're all good options. The weight loss is not going to be the same as an injectable. Nothing will be that way. Run away from supplements that are advertising themselves as GLP whatevers, because that's just predatory marketing, and I have a problem with that from the get-go. So just let me know if you have any questions on YouTube. You can see my beautiful face there. I would encourage you to share this, as I think that all of the information you can get is great. And I think your friends could possibly benefit from this, especially if they're using these supplements. This is Shawn Tassone, America's Holistic Gynecologist, author of the Hormone Balance Bible that you can get on Amazon.com right now. My YouTube channel is up and running and is great. Good time, good information. I got about 85 videos there. You can find me on Instagram, Shawn Tassone, MD. Hope to see you around. Have a good one.